Hi, I'm Darnell Cox with Live Young Lifestyle, and I'm here today with Dr. Nina from Nina MD in Beverly Hills, and today we are talking about hormones. So tell me, first of all, what is hormone replacement therapy?
It's a better term to say bioidentical hormone replacement therapy, where we actually use hormones, which are the exact biochemical structure as our body.
So first of all, who is the candidate to be on hormone replacement therapy? Like, what's the age? How do you know when you should start?
Nearly everyone who is in a hormonal decline state, and we're noting that from ages 25 onwards, believe it or not. It varies with everyone what the perfect age is, but generally women who are going through menopause or perimenopause, they've gone through a hormonal decline, and I would strongly recommend them to be what we call low dose physiological replacement, keeping everything in the normal range, but the doctor customizing what is the optimum range to be within that normal range. And without having to take anything orally, because we don't know how it's going to metabolize. Don't take that risk. Do it safe. So the downside of that kind of an approach becomes very minimal.
Is it all done from blood work?
So we check your blood work. Okay. And there's a specific way I check. So it's not really done like you're not going to just be able to go in.
Oh, I know. I've been through it. It's extensive blood work.
It's extensive.
But that's good because
good,
it's not one size fits all.
Yeah, and it's usually covered with insurance, because most of the blood work is in one facet or the other related to something or the other. So yes, it's an extensive set of blood work, but I really believe in doing a saliva test that is done using the liquid chromatography mass spectrometry method. And that's a very critical way.
That was a whole bunch of science words right there.
So those science words means it's a very amazing way, scientific way of measuring the hormones.
That's the one where you spit in the little tube at 7 in the morning and again at 7 at night, and you freeze them and you send them in, and then they analyze all of that stuff. That mixed with the blood work gives you a real good picture.
Because everything has a circadian pattern of your hormones, and same thing of your cortisol levels, which is also a hormone. And so, yes, it's very important. And we also do the blood work. Sometimes on certain clients, I collect both data points that go into both the blood work and the saliva testing that goes into the decision-making process.
That's what you did for me, because, we had this conversation a couple years ago, and I was still feeling fine. I was barely turned 50. I'm like, I feel great. Like, what are you talking about? And then, fast forward 2 months, and I literally thought I fell off a cliff. Like, what happened? And I was getting unbearable, hot flashes.
Like, I need to come and see you.
It was frantic, because when you start feeling that bad, it's hard to explain to people who've never had a hot flash. And again, I'm estrogen dominant, so when my estrogen dropped a couple years ago, I had nothing to support. I had no other hormones to support, which is going to bring me to the next question, which is, when you do the blood work and you do the saliva testing, what are the normal hormones that are replaced in hormone replacement therapy?
We're balancing the primary hormones, namely estrogen, progesterone, DHEA, testosterone, dihydrotestosterone, cortisol, possibly thyroid, melatonin, possibly, pregnenolone, possibly, and growth hormone. There's ways that we can use peptide therapy to help balance that.
You have me on testosterone, DHEA, so these are, because I was low, these are in the morning and in the afternoon. And then I take the same amount, which I'll show you, very, very small amount. It's really incredible.
It's really cool, incredible how much. When we first started this, a lot of them were just critiqued, and so that's about it. And you put it like this, and a lot of people will say, do the hormones on your fat or your the fatty areas. I don't want you guys to store the hormones. We're doing the creams where you can just utilize it right in the thinner part of your skin, which is right here. It gets absorbed. It's going to give a small peak, and then it's going to dissipate, and then if you need, you get a second peak. That's it.
These hormones, I'm not kidding you, almost instantaneously took my hot flashes away. are the estrogen and progesterone given at night? Because I take that same amount at night, estrogen, progesterone, and then in the daytime I'm taking the DHEA and the testosterone.
We find that sometimes if you're really estrogen deficient, then you may not be able to sleep also, or you start getting palpitations.
But also I found that with the estrogen at night, in terms of the hot flashes, the hot flashes were so much worse at night. And throughout, like you'd wake up in I'd wake up in a pool of sweat in the middle of the night. So I was thinking, this is before I started doing the bioidentical hormones. So I wasn't sure if maybe the estrogen dropped at night specifically.
There's a circadian pattern. So that was the next. Yes, there's a circadian pattern also of estrogen, but also when the body perceives when you're estrogen dominant, or let's say progesterone is declining more rapidly than the progesterone, and if the body's perceiving that, then you have to worry also about cortisol sometimes being elevated, and that can give a second wind. And that can promote also the hot flashes. So it's kind of like a symphony for every person. It's just it's kind of figuring out how that person's circadian pattern of hormones is going to work and where they're deficient.
And that would explain too why some people they might not have hot flashes, but they can't sleep at night. So I love the creams. This is so easy for me. But there are other ways that people, my friends, for example, are getting their hormones, patches, and like, what's the difference between pills and patches and all of that kind of stuff? Injections.
And this is my opinion only, okay? And I'm coming from just a biochemist point of view. I'm a functional medicine doctor, and I like to look at the biochemistry. If I give hormones orally, as we'd already discussed, I don't know how they're going to metabolize. So I'm not taking that chance. There's pellets. I used to do pellets a long time ago.
Pellets meaning what? You put it under the skin?
There are little pellets that you put under the skin. So like near the butt area, right? Near buttock area, you can like do a little procedure. I used to do that and put pellets. But I stopped doing it because, again, if I was to give somebody a really high, let's say a pellet, I don't know what the rate of disintegration is for that individual.
In the past, 20 years ago, the hormones that we're taking these days are not...
I would never touch those hormones that we were taking 20 years ago. I would not recommend it. I'm not going to be responsible for it. I would never do it.
And I think that's what people my age, I'm 53, that's what people my age need to understand is it's not our mother's hormone replacement therapy. They're very different. They're technology, you guys.
I love it.
And there's no reason to be miserable. And this literally has changed my life. But so
you couldn't have said it better.
Honestly, these have really changed my life. And so when I see women suffering and they're afraid to try something, they're thinking it's their mother's hormones. Are there any health risks at all? Because I know that these bioidentical hormones are not like our mother's hormones. It's not like that. But are there any health risks to being on this stuff?
When these hormones are done in low dose, physiological replacement, meaning within the normal range, and just optimizing the ranges by a well-credentialed doctor who knows how to do this, the minimal risk is so little for the downside, because we're not using high doses at all.
Which brings me to the next point, because you're not just treating women, you're treating men as well with low T.
And that's low T is such a different
Let's
issue.
Save that one though for a whole other video, because that's super interesting. So stay tuned. We're gonna do an interview after this.
Absolutely.
And we'll talk about male hormone replacement therapy, which is super trendy right now and not always safe. But it gotta be done right.
Exactly.
Women we get so scared of that word testosterone, but we have it in our bodies.
We're talking about such a tiny dose.
And we naturally have testosterone.
And women have it.
Right.
So we've got to stop that fear. This is the main hormone that prevents sarcopenia, which is a loss of muscle mass.
Yes.
You could be exercising, and you told me one of the complaints, you were exercising until you were blue in the face and not gaining any muscle.
That's when we realized we needed to address the testosterone, because after the age of 30, your fat starts infiltrating the muscle, and it's really hard to maintain muscle mass once you get to be a certain age. And there's also that dip in testosterone. So adding that little bit of testosterone back in leans you out a little bit, not in a weird competitive way, but just gets you back to where your body is more working like it was before.
Get this, 2/3 of your heart muscle has testosterone receptors. It's just a
Yeah.
biochemistry fact. I just leave you with that fact.
So, which brings me to the next question. So now I'm on this stuff, right? I'm hooked. I'm feeling great. I've actually even, it's weird because I think
You look
once
better than you've ever looked.
Oh, thank you.
I mean, you looked amazing to begin with, but I don't know how much better you're going to be.
Oh my God,
because
you're
you
so
look
sweet. But I kid you not, you feel better. When you feel better, you act better, you do better, you do more. It's a cascade of health benefits that happen. So what besides, the hot flashes and all of that, and I've lost a tiny bit of weight, and I think it's from the testosterone. But besides that, like, what are the health benefits of being on hormone replacement therapy?
We have every health benefit that you see chronic disease. It will help with every chronic disease that we have on the chart, which is hundreds and hundreds. Among it, helps with your heart health, bone health. It will help with neurotransmitter health, with immune system function, with gut health, you name it.
How long am I supposed to be on this? And do you wean yourself off of it? Or how does that work?
At what point do you stop? If you stop, the body for about several months, if the receptors are still sensitized, and it'll say, hey, I can handle it. But again, that decline will occur. And I've had many women who will stop and they'll say, okay, it's been 3 months now. I need this.
I know what that feels like to not be on them, and I know I'm nowhere close. I'm only 53, so I'm going to be on them for a while.
I think as long as we want to lead functional lives and
Yes.
quality of lives, because we're not, like, again, in our mother's time, my grandmother's time, when she was old, we took care of her. We let her be on a rocking chair, we let her hormones decline, and we let her age and die. I think in today's society is a little different.
Making sure that you're going to somebody who really knows what they're doing and knowing the pros and cons of this and making sure that you're taking care of your own health. That's a really good way to live young.
Absolutely.
Thank you so much.
Thank you, Darnell.